In southern Africa, the Kingdom of Eswatini is quietly but decisively strengthening its public health defenses, building systems designed not just to respond to outbreaks, but to prevent them. From biosafety and biosecurity to genomics, antimicrobial resistance, and digital innovation, Eswatini is laying the groundwork for a resilient, future-ready laboratory ecosystem.
This biosafety, biosecurity TWG was established approximately 3 years back, following the regional biosafety, biosecurity initiative, which started with the gap that was identified by WHO JEE, which was conducted in 2019. The National Biosafety Biosecurity, it's one of the programs that is very instrumental in terms of implementing biosafety, biosecurity systems in the country. Eswatini member state was not spared from those gaps because it scored less. So from that score, countries were mandated to strengthen the biosafety, biosecurity through the support of African CDC.
The National Biosafety and Biosecurity Program has emerged as a cornerstone of this transformation, guiding the country's efforts to close long-standing gaps and strengthen compliance with global health security standards. Initial assessments revealed critical gaps. Eswatini, like many countries, was not spared. But these findings became a turning point, sparking coordinated national action.
Biosafety, biosecurity in Eswatini, I will talk maybe from the health perspective, but generally we are practicing it in-house through the trainings that we've achieved from the regional centers of excellence, from the reputable trainings that we've been undergoing. But at the end, in order for every lab, every institution, every clinical area that manipulates organisms, they need an overarching framework that will guide the country. It should be a legal document that oversees every function that is within these areas. For the biosafety and security of the personnel, of the environment, of the country as well, both biosafety and security. We are hoping this document will guide us, and then it will enable the country to set up systems where they evaluate all of these centers where manipulation of pathogens happen if they are complying to the framework for the betterment of the staff, the environment, and the entire country. So we are sure there is no biosafety and biosecurity that is compromised as we manipulate the organisms. We look forward to this and are excited. So the country is moving positively, as we will definitely establish a national public health institute to guide even surveillance and research of these pathogens.
A legal and regulatory framework ensures protection not only for laboratory personnel, but for communities, ecosystems, and the nation as a whole. As Eswatini advances toward establishing a national public health institute, biosafety and biosecurity are becoming embedded pillars of surveillance, research, and emergency preparedness. Innovation is also reshaping how laboratories work, especially in the digital space. At the National Public Health Laboratory, data once moved slowly, constrained by disconnected systems and limited connectivity.
As the NPHL, one of our major challenges was with our data transmission. We had problems with interfacing our equipment. So you'd find that you'd be entering different sections just to get relevant data. And also we do genomics sequencing, and we've introduced whole genomic sequencing that produces terabytes of data. So you'd find that in the past we'd have a lot of time taken, close to 3 to 4 weeks, just to analyze our data that we got from WGS. So the Starlink installation has really improved our services and our turnaround time in terms of producing our final calls or variant calls. In terms of genomics, we are now doing it within a week because of the super speed, and also in terms of contamination management, due to moving around within the lab just to get different data from different analyzers, has decreased, because now in one station I get to view all the sections of the lab without any movement around, and I can also analyze my data from any area within the lab. So it really has been great.
Another urgent front in Eswatini's health security agenda is antimicrobial resistance, AMR. Misuse of antibiotics, limited regulation, and gaps in surveillance have fueled resistance, making training and quality systems more critical than ever.
AMR is antimicrobial resistance. Basically, it's bacteria being resistant to antibiotics. So there are a lot of reasons that causes that, but part of those reasons is us as people taking medication without prescription. You just fall sick, and then you go to a pharmacy, and then you buy an antibiotic, and then now you find that your body now starts being resistant towards that antibiotic.
And that requires training. I took the microbiology track, which really impacted a lot on my day-to-day work with regard to issues of food safety and antimicrobial resistance. Taking the microbiology track enabled me to become better in data analysis, in AMR surveillance, and in-depth knowledge with regard to techniques that are now there in the world per se with regard to antimicrobial techniques.
My expectations when this program was introduced, I was hoping to gain skills and knowledge in microbiology, and it exceeded my expectations in the sense that I was able to not only gain skills but also fill in some gaps which I noted from the training program we were missing in our daily practices, especially when it comes to the quality assurance part in microbiology, because sometimes we may put aside those quality activities in the laboratory in microbiology. So it has really improved our testing in the laboratory in terms of the quality of the results that we generate now. I am more confident when it comes to the quality of the result. I've also improved my skills in, microbiology testing techniques.
Through structured learning, laboratory professionals are gaining advanced skills in microbiology techniques, surveillance, and data interpretation. Better data means better diagnosis, better treatment, and better protection for communities. As antimicrobial resistance becomes a daily reality, knowledge is moving beyond laboratories into hospitals, universities, and homes. This is how sustainable impact is built, through empowered professionals who become national resources. From biosafety frameworks to genomics connectivity, from AMR surveillance to workforce excellence, Eswatini's journey is one of deliberate progress. Through strong partnerships, skilled professionals, and forward-looking investments, Eswatini is strengthening its laboratories, protecting its people, and contributing to a safer, healthier Africa.